My name is Albert Severa, and I'm specialized in the transformation and humanization of organizations. A hospital commissioned us this project. The challenge was to humanize the experience of cancer patients in the waiting room. And as we worked and researched, we realized and really understood the great importance of the waiting room in an oncology hospital. Many of you may think of a waiting room as a place of no special importance, but more than just any room, it is a space where the course of life can change from one moment to the next, and where they will spend perhaps the most anxious and stressful times of their lives. The oncology patient will make these waiting rooms his routine environment for approximately 8 to 10 weeks, and according to studies, the average consultation time with the doctor is only 9.5 minutes. However, wait times can exceed 5 to 6 hours. All the patients we had the opportunity to talk to agreed that waiting times are interminable and negatively affect their mood. The clear ultimate should be that these types of wards should not exist. That would mean that there would be no more waiting. But as long as there are waiting times, these types of rooms are going to be delicate spaces that need special attention and a rethinking focused on these patients and their companions. For me, research is the key phase if we want to create projects that have a real impact on people. That's why out of 100% of the time, we dedicate 80% to research. When we have the findings, we spend 20% designing those solutions. In order to understand the needs of the users of this type of space, we divided the research into two parts. The first one is primary sources, where we talked and interviewed different profiles of healthcare personnel, from doctors, nurses, receptionists, administration staff, even cleaning staff. We then interviewed patients who have experienced the process firsthand, patient companions and patient associations. And the second part of the research, we rely on external sources, where we resort to different scientific studies and international research that already dealt with this topic. I will group the main conclusions we have drawn from our research and interviews into 5 areas. The first area is everything related to information. It was reported that the lack of indicative information about waiting time has been considered the main source of stress for patients, to the point that the Director of Healthcare Environments at Steelcase Health stated that information can be the best antidote to anxiety in these waiting rooms. An oft-repeated comment is that they don't understand why they can't know through an information panel, or otherwise how much time they have left for their shift, so they can better organize their time. Point number 2 is the relationship with others, either with other patients or with the patient's companions who are in the waiting room. Patients comment that these are very noisy spaces, and in general it is due to the conversations held by the patient's companions, who are people who are not sick and are bored by the fact that they have to spend so much time in these waiting rooms. The conversations of other patients in the ward also have a negative influence on their mood, and for this I would like to share with you a testimony given to us by a patient. Another common point that exists among patients is their sense of lack of privacy, and when you are at this level of stress, the last thing you want is to be sitting with strangers. In fact, a study by Gerard McMillan showed that the 2 most isolated seats were the most used seats in a waiting room. The third area of research has to do with furniture, and here I know there is unanimity that waiting room furniture is by far the least comfortable and appropriate. We are talking about straight chairs in linear format, ergonomic, uncomfortable, and everyone watching the shifts go by on a screen. There is a lack of space for personal items and technological devices. So much so that an international study showed that 80% of the seats are usually occupied by personal items rather than people, be they bags, backpacks, etc. Patients ask for a greater variety of seats, since the dynamics of patients and their companions are very different, and for example they ask for reclining seats. A study that I find very interesting on patient ecology shows that the use of aesthetically pleasing furniture doubles the perception of healing and reduces patient anxiety. In an international study by Healing Spaces, they showed how the use of color and the use of wood improved people's well-being. The fourth point is the activities that take place in the waiting room, something very relevant because, as I was telling you, the waits are very long. The stress of waiting for their test results generates a lot of anxiety, and they all agree that a positive distraction would help them to minimize this anxiety and stress they feel. Many patients comment that it would be very interesting to have some quality reading material for their waits, whether it is a daily newspaper, informative material, a magazine, or an interesting book. A study conducted by the California Healthcare Foundation on patient experience listed activities that functioned as positive distractions for patients. These included the use of mobile devices, educational materials, watching movies on a television, and having views to the outside. The fifth point has to do with sensory stimulation. In an international study by Lindbergh and Holmes, it was shown that sensory stimulation can be implanted in the patient's body and help them reduce stress. And this is achieved through lighting, temperature, soft music, and warm, energetic colors. I would like to share with you two testimonials from two patients that I believe exemplify very well the need for positive sensory stimulation in these waiting rooms. Those who know me well know that I am a great advocate of recovering contact with nature and introducing nature in general, in this case in hospitals. I would like to share with you a very interesting study that Sarah Blash did on the impact that nature has on oncology waiting rooms. The results of this study were revealing. 81% of the users confirmed that they had been positively affected by the existence of plants. 62% of the users preferred natural plants, and 76% stated that they preferred artificial plants to no plants at all. Once all the research was done and we knew the real needs of the different profiles, we started to create a transformation design that could solve the different requirements and satisfy the needs we had found. Here you can see how we divided the space into three: a multifunctional living room, a leisure area, and a space to relax and disconnect from the rest. In the lounge, you can see how we took into account the patient's request for different types of seating. From chairs so you can have a privacy and be more isolated, spaces for groups, and then a table where you can connect your mobile devices and where you can read or write. We designed a space for motivational phrases from patients who had successfully overcome the oncological process to give encouragement to the people in the waiting room. We also integrated the use of nature and the connection with the outside views. In the interactive room, we proposed a semi-open space where activities such as art therapy could be carried out, and around a library to house quality books and printed media, entertainment material, and a television where they could watch movies, wrapping it by a mural with a landscape that was relaxing and therapeutic. And a third area for those people who need a disconnect and can have a seat that is reclining and have a view to the outside. As you have seen, there are many possibilities for improving the life and experience of patients through proper space management in healthcare facilities. The key, as I said, is to carry out very rigorous research, not to take anything for granted, to open our minds, and to always put people at the center when we have to make any kind of decision. You can write me in the comments of this video which spaces do you consider, in your opinion, and that it is urgent that they begin to transform. Thank you very much for your attention. Like the video if you liked it. Subscribe if you would like to receive content like this video. And most important of all, have a nice day.